Hey folks, Dr. Quaz here again. Peptides seem to be catching on like wildfire, but there still seems to be a lot of confusion on the topic. So what we're going to do is we're going to make a little short video today to discuss certain topics and touch on some major peptides. As usual, everything we discuss today is for educational and entertainment purposes only, and nothing we discuss can be taken as medical advice for your personal situation. Please consult your physician before starting any new medication or supplement.
Ghrp6 is in a class of drugs known as GH secretagogues. Other drugs in this class include ipamorelin, hexavalin, and Ghrp2. The primary function of this class of drugs is to amplify the natural secretion of GH from the pituitary in your brain. It does so by two mechanisms. The first is inhibiting somatostatin, and the second is by enhancing the release of GH through growth hormone releasing hormone.
Growth hormone releasing peptide 6 is a first-generation growth hormone releasing peptide, and it has two main functions. One is GH secretion, the second is appetite stimulation. So before an individual decides whether or not this peptide's for them, they need to decide whether this set of side effects will help them or hurt them. For instance, there's individuals out there that have problems eating enough food or getting their caloric intake in for the day. A Ghrp6 peptide with the appetite stimulation might help that individual, as opposed to an individual who's in contest prep or trying to lose weight or follow a meal plan. It might be more hard for that individual to stay on the meal plan with the side effect of the appetite stimulation from the Ghrp6. If the individual is in some type of meal prep or trying to diet, they might want to look at a different peptide, for instance, like Ghrp2 or ipamorelin. The most common benefits of growth hormone releasing peptide 6 are increased cellular repair, increased bone density, increase in collagen synthesis and production, increase in lean mass, which means muscle mass, improved sleep, reduction in body fat, increased IGF-1 levels, which is also very important. Other side effects of growth hormone releasing peptide 6 include fatigue or tiredness, some people complain about. Water retention is another issue. Numbness and tingling in the extremities. There's also a decrease in insulin sensitivity, and there's also possibly you can have the symptoms of carpal tunnel syndrome in your extremities, which would just be like a numbness and tingling in your extremities. Now, the protocols or the theoretical protocols for the use of growth hormone releasing peptide 6 would be, number one, and the most important rule, is you have to be fasting for 2 hours prior to the injection. So the injection must be done in an empty stomach with a minimum of 2 hours of fasting. Once the injection is done, you then have to stay fasting for another 30 minutes post-injection. That will allow you to get the maximum effects of the growth hormone surge. You'll inject anywhere from 100 micrograms to 300 micrograms, anywhere from minimum of 3 times a week up to 4 times per day.